And it's with great pleasure that I now announce to you our next speaker, who is Dr. Ed Gogek. Dr. Gogek is a psychiatrist with a special interest in substance abuse, and he has treated more than 10,000 addicts and alcoholics in jails, prisons, homeless clinics, mental health centers, and addiction treatment programs. Dr. Gogek's opinion pieces have appeared in the New York Times and over a dozen major U.S. newspapers. He's the author of Marijuana Debunked, a handbook for parents, pundits, and politicians who want to know the case against legalization. I have read this book. To me, it's become my go-to manual. He did a fantastic job researching all aspects of marijuana. We're fortunate today not only to have Dr. Gogek as a speaker, but he also has his books for sale right outside in the lobby. And during the break, if you get a chance, to me, it's just been a fantastic. I actually own several copies, so I can have them in all my different locations. But with that introduction, let me invite Dr. Gogek up here and look forward to his presentation.
So thank you all. Thank you, Sheila, for inviting me. If I'm shivering, it's not because I'm afraid of public speaking. It's cold in here. I'm a psychiatrist, and basically I'm a frontline psychiatrist. I work with drug addicts. Lately, it's mostly mostly heroin addicts who I work with. And that really is part of what inspired this talk. There's two things. One is let's look at this. There we go. A lot of these news stories have appeared lately. I don't know if you noticed them, but they rankle me. That marijuana is going to help curb the opioid epidemic. These things bother me, but what really triggered this in a way is the patients that I see, because there's a story I hear so commonly. And I ask my patients, what's the first drug or alcohol you ever did? And the most common story I hear is at 12 or 13, they started smoking weed. At 15 or 16, they started doing Percocet. At 18 or 19, they started doing heroin. It's just, those numbers just seem to come off all the time. And this news story has been out all over the country. It's on billboards saying that marijuana is going to curb the opioid epidemic. My aim today is to show that this is not true. And I'm just going to go over a couple things. I'm going to show that the gateway effect is real, and it's quite serious, that marijuana does lead to other drug use. The evidence that medical marijuana laws cause higher rates of teenage use is very real, and the research is not reporting it right now. And I'm going to show why the research for these news articles is probably wrong. And then I'm going to look at cannabidiol, which is the one place where the marijuana folks have something that's probably helpful, although the way they're promoting it I don't like. So I quickly want to go over the opioid epidemic. And it's been a serious epidemic. This is 2014 data, 33,000 deaths by opioid overdoses in that year, which is a lot. And we've lost patients who we know, people who normally we see them quite often because they relapse and come back, and then they don't come back, and we hear that they've died. And that's from heroin and fentanyl. But I want to put it in perspective. Alcohol-related deaths are about 3 times the opioid-related deaths, and for every opioid-related death, there are 15 people who die from tobacco. So legal drugs are always a much more serious problem than drugs controlled by prescription or drugs that are strictly illegal. And this is what it looks like. In 2014, what we saw is that the prescription opioids, the blue line there, started taking off in the 90s and quadrupled by about 2010. And then in 2010, heroin started increasing and quadrupled just over a couple years. And these are opioid overdoses. 1 year later, heroin overdoses had caught up with prescription opioids, and then fentanyl was on the scene. And then a year after that, fentanyl had passed by both prescription opioids and heroin. Fentanyl is really quite serious. It's really potent. Addicts like it, but it's very, very deadly. So we're really looking at 3 different epidemics. and they have 3 different causes. And what I want to say is anytime there's a craze or a fad or something or an epidemic like this, it is marketed. You know, hula hoops didn't happen by accident, neither did fidget spinners. And drug epidemics are the same way. They don't just happen, they're the result of a marketing. The opioid epidemic was created by the pharmaceutical industry. Here's this nice quote from Claire McCaskill. "This epidemic is the direct result of a calculated sales and marketing strategy." And it really was. I used to be a real wall about opioids, so did a lot of doctors, and we would just say, no, chronic use does not work. All you do is build up more pain receptors. And then all these experts started coming out in the 90s and saying, no, chronic use of opioids does work for pain, and that it's not so addictive with people who have chronic pain because they just use it medically. And what else did they tell us? That we're under-prescribing and we're under-treating pain, and it's shameful. Well, it turned out that those folks were paid for and promoted by the pharmaceutical companies, and it created an incredible epidemic. There were people who were screaming that we're creating an epidemic, and they were mostly ignored by the press and by the medical community, very much like the anti-marijuana community is experiencing today. This is from Scientific American, which once upon a time was a really good science journal. And this article is written by somebody who does pain research for a major university, a professor of psychology. And you look at what he says here. Contrary to popular belief, the author says, morphine taken solely to control pain is not addictive. That is not true. It is a lie promoted by the pharmaceutical industry, and it's responsible for hundreds of thousands of deaths. And the lesson from this is scientific experts can't always be trusted, nor can scientific journals, unfortunately. And I hate to say that because I'm not used to thinking that way. So that's the prescription opioid epidemic. The heroin epidemic has a totally different source. And this is from, I really like this. This is from Esquire magazine. They did this article on the heroin epidemic, and he says, okay, I'm going to say it. The heroin epidemic was caused by the legalization of marijuana. And what happened is that 20 years ago, marijuana pretty much came from Mexico. And then today, the best weed is grown in the United States, and the cartels simply could not compete. You know, they told us it would put the cartels out of business. Well, it did. In a single year, according to Esquire, the Sinaloa cartel lost 40% of its marijuana business. So instead of going out of business, what they decided to do is introduce a new product. And they decided they'd compete with the pharmaceutical companies. So they switched to heroin, they ramped up production, they dropped the price. A survey done in 2014 of heroin addicts, they said that the reason they used heroin, 94% people, heroin users said it's that prescription opioids are way more expensive and harder to obtain. So what the cartels did is they piggybacked on the prescription opioid epidemic, but the heroin epidemic was caused by a lot of cheap heroin. It wasn't caused by the prescription opiates. And the Mexican farmers, of course, this helped them as well. So we've been told legalizing marijuana is supposed to put the cartels out of business. Now what they're going to be saying is the only way to put the cartels out of business is to legalize everything. The other alternative is actually to stop using drugs. I'd like to remind people, well, if you've ever worked with alcoholics, the last thing they think about is stopping, and this is true for drug addicts. I remember this one patient who was so proud that she sold her car so she wouldn't drive drunk, and I glared at her, and she goes, "What's the matter? What should I have done?" I said, "How about stopping drinking?" And she had never thought of it, and that really is the way addicts think. But in the 1940s and 1950s, there were no cartels, and there were still strict drug laws. The fentanyl addict, so this is the source of opium. Now, basically, most of the opium in the world comes from Afghanistan. Ours comes from Mexico. Fentanyl, totally different source, manufactured in China by the pharmaceutical industry there, very poorly controlled. And it's in tiny quantities, which is all it takes. It's shipped over to the United States. What do I say? There are actually very intense high, very deadly. Like I said, we're losing a lot of patients. Dealers are actually now handing out Narcan. to their customers. I've had people come in and say they actually got Narcan when they bought heroin and they were told to keep it with them because the dealer didn't even know if there was fentanyl in there or not. So I want to explain, because we do hear a lot, they say, oh, the opioid epidemic is what caused the heroin epidemic. And I want to explain how they really, they use this dishonestly. So if we look backwards, so if you start with heroin and look backwards, about 90% of heroin addicts started with marijuana. And the pot lobby hates it when we say that because they say, well, you could say they started with mother's milk or they started with water. And they're right. You could say that, and it'd be just as true. Looking retrospectively is not a really good way to do this. If you look prospectively, what you find is roughly about 10% of marijuana users go on to use heroin. It's very different. The same thing is true of prescription opioids. Almost every news story about the heroin epidemic says 75 to 80% of them started with prescription opioids, which is true, but that's looking retrospectively. If you look prospectively, it's about 20% of prescription opioid abusers who actually go on to use heroin. And so people who are experts on this should know this. This is from National Public Radio, Science Friday, Ira Flato. He is a science journalist. He should know, and he's interviewing an editor from Scientific American who also should know. But what he said is really misleading. He said, the majority of people who use marijuana do not go on to use harder drugs. That's a prospective way of looking at it, and it's true. But then he switches to retrospective and says, meanwhile, nearly half of young people who inject heroin first abuse prescription opioids. So he's mixing the two, and if you don't realize that, it makes it sound like opioids are much more likely. It's not. People who abuse prescription opioids and people who use marijuana are pretty much equally likely to end up using heroin. But they do this to make it sound like marijuana has nothing to do with it and prescription opioids do. That is dishonest journalism. I don't know how else to put it. So let us not be slipshod here about our own scientific reasoning. And the question I'm setting out to answer today, and I'm going to spend most of my time, is do loose marijuana laws contribute to the opioid epidemic? Because we've seen all these news articles saying loose marijuana laws will make the opioid epidemic better. And I'm going to show you that that's not true and the opposite is true. So we'll break this into two parts. First of all, do loose marijuana laws cause increased teenage use? And then does that teenage use cause increased opioid abuse? And we'll look at the second question first. And that's really the question of the gateway effect. Does teenage use lead to opioid abuse? And the news media has told us that the gateway effect is not for real. And there's reasons that they've said that, but it's not the whole story. It actually is for real. So we're going to do this really carefully in a persnickety scientific way, and to prove causation, you really only need 4 of these things. So I'm going to go over these. So cause and effect have to occur together. So for us, teenage marijuana use is linked to heroin use. And then the second, when you don't have the cause, you don't have the effect. So people who don't use marijuana are much less likely to use heroin. We have to prove those two things. They tend to show up together in any study. The third thing is the cause has to come before the effect, the marijuana before the heroin. And usually those 3 things are pretty easy to show, and I'll show them. The fourth one is that we have to eliminate any alternative explanation. And this is where scientific studies always get caught up, because correlation does not mean causation. Sometimes it really is just a coincidence. And what they'll point out is an abused kid is more likely to use marijuana, but he's also more likely to use heroin. So it's the abuse that's leading to the heroin, not the marijuana. And they're correct when they say that. And then the fifth step, which is not always necessary, is finding a mechanism. The tobacco industry used to just always say that, sure, cancer and smoking are linked statistically, but there's no evidence that it really does cause it. And then they finally found a mechanism that says, yes, there is. So it's nice to have a mechanism. So let's go back to this. Steps 1 and 2 are easy. Teenage marijuana use is associated with high rates of illicit drug use. Non-teenage marijuana users have very low rates. So here's a review of all the studies published in Lancet, and that's what they found. Teenage marijuana use is associated with higher rates of using other illicit drugs. Now, when I go over these, some of them are about illicit drugs, some are just about heroin or opiates. I'm kind of going to mix the two together. Here's 3 more studies showing the same thing. What are they? A 2000 study found that 37% of teenage marijuana users used other drugs by age 21, whereas fewer than 1% of non-marijuana users used other drugs by age 21. Pretty big difference. There's a 2015 study that found that 44% of marijuana users sometime in their lives use other drugs. Pretty significant number. And then a third study that just compared the two. And I like because they looked at occasional users. Occasional users compared to non-users were 21 times as likely to go on to other drugs. And the heavy users were 124 times more likely to go on to other drugs. So we showed parts 1 and 2 of proving causality. Like I said, you got to be persnickety on this. The third step for proving causality is that the pot comes before the heroin. So that 2000 study looked at like 1,200 kids, and of the ones who used both marijuana and hard drugs, marijuana came first in all but 3 of the cases. That's pretty good. And then Drug and Alcohol Review did this review of all the studies back in 2005, and the 2 things they found that stood out most were that marijuana use usually precedes the other drug use, not the other way around. And the earlier and more regularly the marijuana is used, the more likely they are to use other drugs, which also shows causation. But it still leaves us with 3 possibilities. Like I said, there's always the big bugaboo with research is alternative explanations. And some people have tried to control for these, but basically, the question is, the people who use marijuana, are they more likely to use other drugs anyway? So for example, somebody with the genetics for addiction is more likely to use marijuana than the average kid, and they're also more likely to go on to other drugs. So it's not the marijuana doing it, it's the genetics for addiction. And the second question is, marijuana introduces people to an illicit drug market, and they hang out with a bunch of drug users. And so it's the illicit drug market and the hanging out with other drug users that makes them go on to other drugs, not the marijuana. Those 2 things are actually true. The question is, are they the entire truth? Or is the third one also true? Does marijuana also affect the brain in a way that makes other drug use more likely? And that's really what we need to show causation. And I want to do this just because we keep hearing the gateway effect isn't real, and I want to show that it most definitely is. So a lot of researchers have made some really heroic attempts to they've come up with like 30 different possible alternative explanations and controlled for them and showed that yes, we still find that teenage marijuana use is associated with much higher rates of other drug use. But it's never possible to totally do this because the problem we have here is that we're not randomly assigning people to smoke marijuana. They're choosing it. And so automatically, the people who smoke marijuana are different from the non-users because they chose to, and there might be all sorts of factors. And it's really impossible to always rule out all those factors. And the other thing is that they hang out with other drug users, and we can't. So what we would actually need is an experiment where you take 2 groups of kids. I'm not suggesting doing this at all. You cannot do this. But this is what you would need to do. You would need to take 2 groups of kids and say, you guys are going to smoke pot and you guys aren't, and you don't get to hang out with any other pot users. We're just going to offer you heroin and see who likes it the most. You can't do that with human beings. You can do it with animals. And that's what's really shown the gateway effect, is animal studies. There's a whole bunch of studies on rats. And they all run the same way. They all take rats, adolescent rats, and they expose them to THC. And then later on, they expose them to heroin and see who uses them. And what they find is that they're more likely to use heroin. When they use it, they use more of it. That they actually have altered opioid receptors in the part of the brain that's the reward center that gives you all the pleasure. And the interesting thing is that Well, and it works with everything. So adolescent rats treated with THC developed a tolerance to morphine, cocaine, and meth. Interestingly, when they did the same thing with adult rats, it didn't make any difference. So there's something going on, and we know that. The teenage brain is going through development, and so this is affecting the teenage brain. And then we also know that heroin, if you teach rats to use heroin, and then you give them THC, it will trigger the heroin use. So this also tells us a little bit about the mechanism, which is that it actually changes the opioid receptors and changes the reward pathways. And so these studies pretty much eliminate all those alternative explanations because rats don't succumb to peer pressure. And they were chosen randomly. Just a couple more studies, because I like studies. So they did the same thing they gave female teenage rats THC and then looked at their offspring. And their kids actually had more opioid receptors in the reward centers, and they would make much more effort to get heroin. And interestingly, alcohol and tobacco do not seem to alter the brain's response to opiates. A study of women who used marijuana during pregnancy, and they looked at their kids, and they actually had altered opioid receptors in the reward pathways, and alcohol and tobacco did not do this. So here's the mechanism. THC changes the reward pathway. It changes the opioid receptors when used in the teenage years. And that's because teenagers, their brains are still developing. Also, this seems to be unique to marijuana. Alcohol doesn't do this. And so this is a biological effect marijuana has on the teenage brain that makes teens more likely to use other illicit drugs, especially the opiates. Seems to be there's a special relationship between the body's cannabinoid system and the body's opioid system. I just want to stress that the younger people use marijuana, the more likely they are to go on to other drugs. And that's because ages 11 through 14 are when the brain is going through the most rapid developmental change. At least that's what I think. So, have we proved causality? The two are correlated, absolutely. Cause and effect are found together. When teens don't use marijuana, they're very, very unlikely to go on to the drugs. The marijuana almost always comes before the hard drugs. Have we gotten rid of the alternative explanation? Yes, because none of those alternative explanations apply to rats. And we also have a mechanism. So I would say pretty definitely that the gateway effect is real, that teenage marijuana use does lead to higher rates of opioid abuse, which is a big concern, because right now we have a lot of teenagers using marijuana and we have an opioid epidemic. But let's look at the first half of that question. That's a little harder. So, does loosening marijuana laws increase teenage marijuana use? And this one is kind of debated in the scientific community. Most of the research does not find a link. And I actually emailed somebody who's going to publish a review of all the studies, and she said, we find it with adults, we don't find it with teenagers. And I'm a little bothered by that, and I'll tell you why. So, first two steps are the same question. So, does our medical marijuana laws? Can you hear me when I stand back? It's a good microphone, so I don't need to yell into it. Okay. Medical marijuana laws are associated with higher rates of teenage use, and states without medical marijuana laws are associated with lower rates of teenage use. And there's research showing that for adults and for kids, and we saw this graph this morning. This gets shown every year at this conference. This is a common graph. And I mean, it's overwhelming. Of the 20 states with the highest rates of teenage use, this is teenage use, the number one is Colorado, down at the bottom is Alabama. Of the states with the highest rates of teenage use, they're all medical marijuana states. Of the states with the lowest rates of teenage use, none of them are medical marijuana states. So, those first 2 points. Are medical marijuana laws associated with high rates of teenage use? Yes. Are lack of medical marijuana laws associated with a low rate? Yes. So we can go on to question 3, which is, do the medical marijuana laws come first? And that's been shown for adults. really pretty clearly. Let me see where I am. So this is for everyone over the age of 12. And what they found is before they had medical marijuana laws, these states were all were really close together. And let's see if I can do this. So you see, these are the medical marijuana states. They're increasing a lot faster. The non-medical marijuana states are increasing much more slowly. You know, medical marijuana versus non-medical marijuana. And so that's really good evidence that the law change came and then the increased use. And that's pretty much what we need to prove causation for adults. The trouble is, there is no study like this for teenagers. And I have to ask about that, and I want to go into this because this is really important, because right now there's going to be a study coming out pretty soon that's a review of all these, and it's going to say there's no evidence that medical marijuana laws increase teenage use. And I just don't think that's true, and I'll tell you why. If we want to see the effect that marijuana use have, that medical marijuana laws have, we have to look at times when there's a lot of medical marijuana being used. And there's a lot of these studies that were done back before 2004 when there just wasn't a whole, these laws were young and there wasn't a lot. So like in Montana, there's a study that was done by these guys, Reese and Anderson and Hansen, who are very pro-marijuana. And they looked at the medical marijuana states for 3 years after the laws were passed, and they found that there was no increase. And it got publicized all over the place as proof that medical marijuana laws do not increase marijuana use, and that's not true. All they showed is that they did not find the increase. 3 years after Montana passed its law, there were 500 medical marijuana patients in the state. 3 years after Colorado passed its law, there were 1,000 medical marijuana patients in the state. Go a few more years after that, Montana went from 500 to 30,000 when they started having these marijuana caravans go around the state and sign up medical marijuana patients. In Colorado, when they changed the rules about dispensaries, it went from 1,000 up to over 100,000. But the study didn't look there, and that's what I'm saying. They're not looking in the right place. So if you just look in the early years of medical marijuana, you're not going to find it. Now, also, so studies like this cover all the years, from before medical marijuana up to today. And there can be a problem with comprehensive studies. They can actually be too comprehensive. What I like to say is, if you did a study of every single person who ever had one drink of alcohol in their lives, you would probably not find an increase in cirrhosis of the liver. But if you narrow it down to people who drink at least 10 drinks a day and have done that for years, you will find that. And they can say, oh, you're cherry-picking the data. No, you're not cherry-picking the data. You're focusing on the time or the place where the problem actually occurs. And this needs to be done with this too. So this is a graph of adult daily marijuana use. And what you see here is it starts to pick up around 2005. And it keeps going up. And that's why adult use, it's pretty easy to, and then what you can do is you can look how much of this is from medical marijuana states or non-medical marijuana states, and that's why you can prove that it's going up much faster in medical marijuana states. This didn't happen with teenage use. So this is a graph that gets used to show that teenage use tends to be the mirror image of their perception that it's harmful. And you see in this. What did I do? Uh-oh, I'm in big trouble now. There we go. So this is past year use. When the perception that it's harmful is really low, past year use is really high. When the perception that it's harmful goes way up, past year use goes down. It keeps going like that until 2011. And then we see the perception of harm drops way down. Past year use did go up between 2005 and 2011, and then it stayed steady or even went down a little bit. And this is what throws everything off. And I look at that, and this graph, I keep looking at it and go, something is very wrong here. Teenagers are acting very strangely. And I go, did teenagers change all of a sudden in 2011? And it turns out that they did. There's an article in The Atlantic recently. I'm not going to say they changed suddenly in 2011, but there's a change that's happened. And this Atlantic was about the first post-millennial generation. And the author calls them the I generation. These are the kids, the first kids to grow up with the internet who had smartphones by the time they were 12 years old. So they went through the entire, the oldest of them I think are about 20 now, not even that old. But they're the teenagers who have smartphones and are used to using them. And I don't know if that's the cause or not, but what we know is this seems to be a remarkably unrebellious generation. They are in no hurry to grow up. And what we find is they're not separating from their parents the way other generations have, and all these separation behaviors have dropped really significantly by about 20-25%. This is a picture of the generation. We know this. And I don't know that this is so bad, because these are the kids who will hang out with their parents and still be texting and Snapchatting their friends. So here's the data on this. They are not hanging out with their friends as much. It's about a 20% decrease in the amount of time spent away from their parents with other kids their own age. And it's not just not hanging out with their friends. No rush to drive. I got my driver's license the day after I turned 16. These folks are waiting, and they don't drive. They let their parents drive. They're not as interested in it. Less dating, 20% less. And you can see it's really dropped off since a little after 2010. And I talk to people who have kids in this age range, and they say, my 15-year-old kid acts like he's 11. Or, I've got this very good-looking 16-year-old daughter, and she's never had a boyfriend in her life, and she acts like she's 13 the way she hangs out with her friends. And they're having less sex, especially in the younger years. They're actually waiting longer to have sex. That's what's going on with this generation. I can't say why it's happening, but it really is happening with this generation that was born around 97, 98. It's a really significant difference. This one's hard to see. The red line is alcohol. That's all I want to show here. Alcohol use has been dropping ever since the 1980s. Teenage alcohol use has been dropping since the 80s. But it went through a huge drop with this particular generation. It dropped 12% in just 5 years. And so then I put all these together. Very lazily did this graph. So the top one is teenage marijuana use, and all those other behaviors are down below. The dark red one is alcohol use. And what you can see is teenage marijuana use is going down in this generation. That's since 2010. But it's not going down at nearly the rate of everything else, including alcohol use. This is what Sheila showed us this morning. And I just want to say, I think a generation that uses less alcohol, less marijuana, is in less of a hurry to have sex, is not in such a hurry to grow up, that's not a bad thing. I remember the kids in high school who were not in a hurry to grow up. They were considered maybe a little dorky, I don't know. But they turned out to be just fine adults, whereas the kids in a big hurry to grow up often got in a lot of trouble. But my point is about their marijuana use. Compared to the drop-off in other teenage behaviors, marijuana use is remaining relatively high. And I think if it weren't for the medical marijuana laws and legalization and all the pro-marijuana talk we're getting from the news and entertainment industry, that this line would probably drop off just as rapidly as the others. And researchers should be taking this into account. And I think the problem is that they're not. So when they look at this data after 2011, all they see is that teenage use isn't going up, it's even going down a bit. They are not adjusting. And researchers are really good at adjusting for all sorts of alternative explanations. That's their job. But I don't think anyone's doing it with this. And if they did adjust, what they'd find, I think, is that marijuana use, the adjustment is really simple here. You take that alcohol graph and you figure out what you have to multiply it by to turn it into a straight line, and then you multiply the marijuana graph by the same thing. And that adjusts for the fact that this is a different generation. And so I did that. So this is what, this one down here is what marijuana looked like before I adjusted it, before I adjusted the alcohol, it's down here. And then alcohol went up to this, and marijuana went up to this. It actually turned into a straight line that kept going up. Now, it doesn't mean teenage marijuana use is really going up. What it means is relative to alcohol, it's going up. What it also means is that, I'm probably right, that what we're seeing right now, the reason teenage use is not increasing is because of this effect of this different generation. And researchers should take that into account, and they're not. So I'm not going to make them do this, although I'd like to, anyway. So what we have is the years between 2005 and 2011, which I think are pretty significant. It's a time when teenage use went up a whole lot, and so I've looked at that. This is not published data, and I'd like to publish it. If anybody knows a good statistician who would help me out, I'd love to get this published, and that's a real plea. What I did here is just National Survey Drug Use and Health data, 12 to 17-year-old, path month use. The red line is medical marijuana states. The blue line is non-medical marijuana states. The last 3 dots on that line are statistically significant. Teenage marijuana use increased much more in the medical marijuana states than in the non-medical marijuana states. That's that whole question that we have. In fact, it's pretty extreme, although I don't know the error in this, but in the medical marijuana states, it went up about 33%. In the non-medical marijuana states, 6%. It was essentially flat, which means that most of the increase that happened in those years came from the medical marijuana states. There were only 10 medical marijuana states in 2005. They only had 20% of the US population. In this graph, they accounted for 60% of the increased marijuana use in the country. So I'd like to get this published, but I think it's pretty safe to say that the medical marijuana laws come before the increased teenage use. Let's see what I'm looking at next. What else do I want to say here? Anyway, so that does the third step. The fourth step, now there's a few more studies that show this. There's a study showing that teenagers in medical marijuana states are more likely to try marijuana, not so much more likely to use it. Or that states with registries have increased use, but not the states in general. And so the fourth step is always, are there alternative explanations? And actually, there's no alternative explanation I know of for this. It doesn't mean there aren't any, and I'm sure some will be proposed. But it's hard to think of something that would cause a state to pass a medical marijuana law and then cause teenage use to go up that has nothing to do with the medical marijuana law. Nobody's come up with one of those yet. Of course, there could be something totally coincidental that has nothing to do with any of this. And I haven't controlled for it in this. But we do have a mechanism. Chris Thurstone did this study, and he found that the teenagers in substance abuse treatment in medical marijuana states, half of them got their pot from people with a medical card. So it increases availability. We also know advertising is a factor. Teens in middle school who saw medical marijuana ads were more likely to try the drug. And it's more accepted. They found that teenagers who are at no risk of using marijuana have said that if it were legal, they would use it. So we got a mechanism. So, do medical marijuana laws increase teenage use? They're definitely associated with higher rates. There is evidence that the medical marijuana laws come before the higher rates. It's not published. The time course, there's no alternative causes proposed, and we have a good mechanism. So I would say yes, medical marijuana does increase teenage use, but it's not as definite as what I said about the gateway effect, that teenage use definitely leads to increased drug abuse and opioid use. But if we put this together, medical marijuana laws increase teenage use? Yes, probably. Teenage use then goes on to increase opioid use? Most definitely. So what this tells us is loosening our marijuana laws, at least with medical marijuana, is probably making the opioid crisis, and especially the heroin epidemic, worse. And that's really, really serious. And that is the question that I want to answer here. And I think the science is in favor of this, is in favor of us saying this. And this is a big problem because, like I said, I tend to hear from my patients, they start with pot, then go on to prescription opiates, then go on to heroin. This is the really common progression. And one of the reasons it's happening, not the only reason, but one is marijuana alters the teenage brain and makes it more likely to enjoy opiates and get addicted to them. How much of this epidemic, this current epidemic, is caused by marijuana, I don't know. But I'm certain that teenage marijuana is making it worse and making it harder to solve. It's going to be a lot more intractable for that reason. This is not what we're hearing from the news media. What we're hearing from the news media is just the opposite. So here's Rolling Stone. Medical marijuana could help end the opioid epidemic. Medical marijuana, Time Magazine. Medical marijuana will help end the opioid epidemic. Newsweek. Can legal marijuana solve the opioid crisis? Medical pot states see decrease in painkiller abuse. By the way, that's not true. And I'll show you that. Science Friday from National Public Radio. Is marijuana the secret weapon against opioids? But it's not limited to the mainstream media. Here we've got Newsmax, which is right-wing media. Medical marijuana helps ease the painkiller addiction crisis. Here's Tucker Carlson's Daily Caller. Opioid abuse is plummeting in states with legal marijuana. That's actually not true, and the research he's quoting, that's not what it shows. The Koch Institute. Is medical marijuana the solution to America's spiraling opioid crisis? And Fox News. Could marijuana help treat painkiller and heroin addiction? So we are getting this from both sides. And the thing is, all these studies, all these news stories are based on 6 studies. And 3 of them show that there's about 25% fewer opioid overdoses or hospitalizations in medical marijuana states. And that was that billboard that Sheila showed us this morning. And there's 2 studies that show that in medical marijuana states, there are fewer prescriptions for opioids. And one, there are 42% fewer. And then the last study, we can really throw away. All they did is interview marijuana users with chronic pain who reported that they used fewer opioids, and they tabulated it. So it's not much of a study. But these other 5 studies are actually very well written. I give them to other researchers, and they read them and go, oh, this is a very good study. Internally, very consistent, very well done statistically. So we've got these 3 studies, Backhuber, Yuan Shi, Powell, and Pacula. And Rosalie Pacula has been a lifelong researcher with the RAND Corporation. She's a good researcher. 25% lower rate of opioid overdose mortality, 23% fewer hospitalizations, 25% less opioid mortality. These other 2 studies by Bradford and Bradford, far fewer opioid prescribing in medical marijuana states. So, but I look at this and I have a problem with this. And my problem is really simply that these are simply too good to be true. 25% decrease in opioid overdoses. I mean, this is actually a very simple intervention. You just change the law and you cut it down by that much. I mean, I know if you make something strictly illegal, you'll get that. But by allowing, and what we know, anyway, and there's 3 reasons why I find this ridiculous. It doesn't make sense to me. One is, for medical marijuana laws to have such a dramatic effect, every medical marijuana patient would have to be legitimate. And we know that they're not. There's this study of 4,000 medical marijuana patients, and it found the average was 32 years old, 3/4 were male, 90% had been smoking pot since they were teenagers. In Montana, 10% of everybody on probation and parole at one point had a medical card. When I worked in the jail, I would see lots of people with medical cards. I now, with my 22-year-old drug addicts, lots of them have medical cards. They don't even know why they got the card. They're not using it medically. So we know that this is not true. There's simply not enough genuine medical users to get these dramatic results. The other thing is we also know that a lot of the folks who smoke pot for pain still use opiates. And these studies only make sense if all the people who use marijuana for pain stop using opiates. Otherwise, the number of opiates couldn't drop that much. But third and most important is these dramatic differences between medical marijuana and non-medical marijuana states that are in all these news stories and on that billboard could only happen if no one in those non-medical marijuana states used marijuana medically. If everybody waited until they lived in a medical marijuana state to then go get marijuana and use it medically, whereas nobody else ever did. And that's not true. And a study came out just this year, and it confirmed this. People do substitute marijuana for prescription medicines, especially opioids. Not most of them, but definitely there are people who do this. But they are just as likely to do that in a non-medical marijuana state as in a medical marijuana state. So these 5 studies are all based on the idea that more people use marijuana medically in medical marijuana states, and that is probably not true. So it's based on an idea that's probably not true. If there's a difference in opioid prescribing or opioid overdoses, it's probably not caused by medical marijuana laws. There's probably an alternative explanation that they didn't catch. And so no matter how well written these studies are, I'm pretty sure that something's wrong, and I think I know what that alternative explanation is, and I'm going to show it to you. So you remember those 5 steps. We said the most common problem is that there's an alternative explanation that people haven't figured out. And the problem in this case, and it's kind of hiding in plain sight, is opioid prescribing. They're all assuming that opioid prescribing is a result of having a medical marijuana law, whether or not you have one. Where are we? Oh. You don't want to read this. I'll read it to you in a second and translate it. Three of these studies did something they called fixed effects model. Those first 2 studies just did nothing to control for levels of opioid prescribing. They assumed opioid prescribing was simply a result of medical marijuana laws, period. These other 3 studies used something called a fixed effects model. And fixed effects is the statistical technique, and this is one of the researchers saying. He says it can control for time invariant characteristics from each state, so things that don't change over time, or state invariant effects, things that don't change from state to state. But if it varies both with time and from state to state, our model does not correct for it. Well, the problem is opioid prescribing changes both from state to state and by time. So none of these folks have corrected for it. And I've read over these studies. They didn't correct for it. At least I couldn't find where they did. So, and we know this is just showing that opioid prescribing did increase. This study says it doubled, CDC says it tripled, ASAM said it quadrupled, whatever. It's not fixed. It changes with time. This is more important. This is actually, this and the next map are the most important things I'm going to show today. And so I want to look at this pretty carefully. This is a map of the difference in opioid prescribing in different states. And what you see is that the states in purple have the highest rates of opioid prescribing. And if you look at these states, only one of them, Michigan, is a medical marijuana state. And then you look at the ones in yellow, which are the lowest rates of opioid prescribing. It's about half as much in those states. And almost, almost half of those states, 5 of them, are medical marijuana states. Alaska, Hawaii, California, and Colorado, which are huge medical marijuana states, and then also Vermont. And so I'm going, well, maybe these guys are right. There is a lot less opioid prescribing in the medical marijuana states. But look carefully at who these states are. So look at this. There's Oklahoma. There's almost all of the South, except for Florida, Georgia, and Virginia. And then there's Indiana, Ohio, West Virginia, and Michigan. Okay, now go to this map. This is a map of percent of the population with a bachelor's degree. And so the states with the lowest rates of college education are in yellow or really light green here, and it's almost the exact same states. You look at it, there's Oklahoma, almost all of the South, except for Florida, Georgia, and Virginia, and North Carolina. That's the one difference. And then you got Indiana, Ohio, West Virginia, and Michigan. And then over there in the West, you also have 2 other states that weren't included. You got Idaho and Nevada. But these are really almost identical. And it turns out that this is not a coincidence. And this has been in the news lately. This has been in the news quite a bit. There's a study that came out that said white middle-class Americans are dying at much higher rates than they should. In other countries, the mortality rate for this group is going down. In this country, it's staying steady or actually going up. It's a huge difference. And at first what they said is, well, it's caused by suicide, alcoholism, and drugs, especially the opioids. But they've gone further, and they've looked at it, and they said, what's going on with these folks is These are the people dying in excess numbers are the non-college educated whites. It's not just the white middle class. And these are the people who've seen their economic prospects worsen over the past 4 decades. And so they call it this disease of despair. And so it really has much more to do with people who, they signed up for, they got a high school degree and they were going to live with that because back in the 1980s, you could make a fine living doing that. And then their prospects have dried up over time, and these are the people feeling that life has left them behind. They were a big issue in the last election. They're still talked about a lot, but what's going on, according to these researchers, is that people are really feeling, left out of where society is and very frustrated, and because of that, they say they're more likely to turn to drugs, alcohol, become depressed, commit suicide, and the other illnesses are striking them as well. So this has nothing to do with medical marijuana laws. This has to do with an economic problem in this country. And it's just a coincidence. If we go back a little bit, no, not that far, this far. So you look at the states with the highest rates of college education, there's Colorado, Washington, Vermont. I think that's kind of nice that medical marijuana states have some of the highest rates of education. But that's what's going on here. That's what this data is showing. So they made a really classic mistake, I think, which is they assumed causation when all they had was correlation, and there's a whole other factor causing it. So I don't think that medical marijuana states are the reason for that. So I think the research is wrong, and I think that all those news articles we see are wrong, and the billboard that Sheila showed us this morning is also wrong. And if you look at this isn't quite as dramatic, but this is the mortality gap for middle-aged whites by state. And you see, it's kind of the same states there. It's Oklahoma and part of the South and West Virginia. So what they did is they credited medical marijuana laws with this. Medical marijuana laws probably have nothing to do with it. It's caused by something entirely different. So it's a good reason not to believe what they've told us on that. I'm doubting that research. This is important because, news outlets, let me just, before I do that, news outlets across the country are telling people that medical marijuana laws are going to ease the opioid crisis, when in fact, what I tried to show you today is they are doing just the opposite. They are increasing teenage use, which increases opioid abuse, and making it worse and more intractable. And this is why it's a big deal. So we've had 3 heroin epidemics in this country. And the first one was about 100 years ago. Back when heroin was originally developed, the Bayer Pharmaceutical Company marketed it as a cough suppressant. They said it was the cheapest and most effective, and it was effective. They also said it was non-addictive, which turned out not to be true. And very quickly, countries across the world started passing laws to make this illegal, and the Bayer Pharmaceutical Company very wisely took it off the market. So we actually stopped that epidemic simply from making the drug illegal. The next epidemic came in the 60s and 70s. It was more of an inner city heroin epidemic. 50% of the folks who were addicted to heroin were African Americans. It was illegal, and we still had an epidemic. Interestingly, Richard Nixon ran on this anti-crime platform, and when he got elected, he turned to his people and said, okay, I said I'd reduce crime, what am I going to do? And they said, you've got to do something about drug addiction. And so he hired this guy, Jerry Jaffe, who was the nation's first drug czar. He was an expert on treating inner-city drug addicts. And what they did is methadone was commonly used in New York, and they basically spread methadone clinics across the country. Nixon's war on drugs has been vilified, and I grew up in one of these homes where we vilified Richard Nixon, so it's very nice to come here and say he actually did the right thing. His war on drugs spent 2/3 of its money on treatment. That's what he did. The other third was overseas interdiction, Southeast Asia and the French Connection. They say that he went after users. He did not go after users. In fact, under Nixon, they got rid of mandatory minimums for drug possession. He actually saw drug use as a disease. This is when we started seeing drug use as a disease in this country, and not just as something criminal. In fact, what they say is Nixon probably used the term war on drugs because he was afraid that the right wing of his party would think he was coddling drug addicts by providing treatment. So he wanted to use a really military term like war. And unfortunately, that seems to be all they remember today. Anyway, this is Nixon with Jerry Jaffe, the nation's first drug czar. So we did two things then. We kept it illegal, and we provided a lot of treatment, and we went after the source. Now, today's epidemic, we can go after the source in Mexico. We can go after the fentanyl in China. I don't know how we'll do that. We can provide treatment, which we are working on. But if widespread teenage marijuana use is making this epidemic worse and more intractable, we are going to find it much harder to root out than heroin epidemics of the past. We've got another factor that's been introduced here. And that is the main point I want to make here. So all this stuff that's in the news is probably wrong. It's based on research that is probably wrong. I'm going to start, I actually have to thank Sheila because she got me looking into this, and once I started looking into it, I go, there's something wrong with this, and just staring at it, I've kind of figured out, I'm going to start writing letters to the scientific journals, and I'll see what sort of responses I get. I want to take just a couple of minutes, I hope I have a couple of minutes, and just talk about cannabidiol. This is totally different. Oh, good, I can do it. So cannabidiol, CBD, is that part of marijuana that's not addictive. It seems to be protective against psychosis. It's been, we've heard about it for treating these rare childhood forms of epilepsy. And what they're finding out is cannabidiol, it actually does a lot of things. I actually think cannabidiol is going to turn out to be the new Prozac. It's going to be everywhere. People are going to be giving it to their pets. It's going to be quite the rage. And in some ways, that's not so bad. So anyway, here's a study that was done. Rats were trained to like morphine, and they were given cannabidiol, CBD, and they lost interest in the morphine. Now, please note that when they did the study, they used CBD from a British company that sells neurochemicals to researchers. They did not buy it from a medical marijuana dispensary. Well, I'm going to show you how the news covers this. Yasmin Hurd did this study, and she's been all over the news. And she's pretty honest in the news about what happened. She did a really simple study. She took abstinent heroin addicts, gave them CBD, gave some CBD, some placebo, and then she used videos to trigger cravings, and there was much, much less craving in the people who had the CBD. And then at the end of her article, she says, we thank GW Pharmaceutical for the cannabidiol used in our human studies. And so I want to point out that came from GW Pharmaceutical. That is the drug Opiates. It is pure CBD made by a pharmaceutical company. They are in the last stages of getting FDA approval. Hopefully, it will be approved next year. We've been saying that for quite a while, but I think it will be. And then she also thanked the National Institute on Drug Abuse's drug supply program for the cannabidiol used in the animal studies. So for all those people who say, oh, you can't get marijuana from the government because it's Schedule I, it wasn't a problem for her. But notice, she did not use dispensary CBD. This is not medical marijuana. This is a pharmaceutical. However, what we're getting from the news media is, so here's one story. A neurobiologist says medical marijuana could solve the U.S. opioid crisis. It's an interview with Yasmin Hurd. Her research was not on medical marijuana. It was on prescription Opiates. This story does not even mention CBD until the 4th paragraph. Never mentions Opiates. And these stories never seem to want to mention that it's a prescription drug. They really seem to want to play up the idea that this is medical marijuana. This is CNN, treating drug addiction with marijuana. And it's not marijuana because if you use THC, THC triggers heroin cravings. You've got to get pure CBD. And the dispensary CBD is usually not pure. So if you read this article, it's mostly about using marijuana, and it doesn't even mention CBD until the 19th paragraph, when they start interviewing Yasmin Hurd. Here's local KJZZ from Phoenix. Could medical marijuana offer promise to treat opioid addiction? Again, this is an interview with Yasmin Hurd. She did not use medical marijuana. So my position on medical marijuana is actually the same as what the Institute of Medicine said back in 2003, which is that It will be useful until we have some prescription cannabinoids available. Well, today we have Marinol and Sesamet that have both been approved in the United States. They do everything that THC can do. So there's no reason for medical marijuana for anything that requires THC. As far as CBD, when a PDLX is approved next year, we hope, there will be no reason for anybody to get CBD from a dispensary. There will be no more rationale for medical marijuana laws. And I think this is why the news media never talks about these prescription cannabinoids. That seems to be the one thing you never hear from them. So, conclusions. Where am I? On cannabidiol, it probably helps opioid craving. I think this is really good news. Heroin addicts absolutely need a drug that can take away craving. If this works, it will be great. But we should be using a PDLX, not dispensary CBD. Dispensary CBD contains THC, which triggers heroin craving. Not a good thing to do to heroin addicts. And once a PDLX is approved, there is no reason for medical marijuana laws. As far as marijuana and opioid abuse, the research showing that medical marijuana is associated with fewer opioid prescriptions and fewer overdose deaths is probably wrong. We'll find out. Medical marijuana laws and legalization probably increase teenage use. Teenage use definitely does increase opioid abuse. The gateway effect is very real. Put these together, loosening our marijuana laws is probably making the opioid epidemic worse, which means that medical marijuana and legalization are probably making the opioid epidemic harder to treat. How much harder, we don't know, but I'm pretty sure that it's making it harder, and so it's going to be a much harder epidemic to treat than past ones. Thank you.